Dear listener, in the next minutes I will present our abstract with the title Focused Ultrasound Treatment of a Spheroid in Vitro Tumour Model with a new FUS Applicator. Most of you are familiar with the principles and technology of focused ultrasound and FUS and the clinical application for cancer therapy. In contrast, in our study, we want to investigate the effects of FUS at a molecular cell level. Here you see a monolayer culture of human prostate cancer cell line PC3. And in typical cytotoxicity studies, they are treated in these 96-well plates. In preliminary experiments, we treated them with FUS in a special ultrasound penetrable plate with a single focused ultrasound transducer. And we saw nearly no changes in morphology and a loss in viability to 82%. To investigate the effects of FUS in a more realistic model, we established tumor spheroids in our lab. Here you can see the 3D tumor of the PC3 cell line, built with the liquid overlay technique in round bottom cell culture plates. In these spheroids, the situation is quite different to the monolayer. You see cell-to-cell interactions and, like natural tumors in a patient, a necrotic core. In our project, we developed a new FUS applicator with 32 cylindrically focusing transducers working at a frequency of 1.1 MHz and driven by a high-powered generator. For coupling, degas water was used, and here on top the 96-well plate was placed. The FUS system was characterized in a water tank using a hydrophone. The -6 dB focal widths in the X and Y directions are 1.4 mm and 5.5 mm. This is below the pitch of the well plate, confirming that there is little influence on individual wells by neighboring transducers. In our study, we used two different cancer cell lines, the prostate cancer cell line PC3 and the glioblastoma cell line U87. For both, we used the liquid overlay technique to build spheroids within 4 days. After checking them and measuring the spheroid size with the microscope, we transferred them individually to the 96-well microclear plates for the FUS treatment. The results showed that there are different effects of FUS depending on the cell line. On the left side you see PC3, and the microscopy analysis of the spheroid showed a decomposition of the PC3 spheroids immediately after FUS treatment at 5.9 watts per square centimeter. Interestingly, the spheroid reassembles 48 hours post-treatment. In contrast, on the right side, the U87 spheroids had a more tightened structure, and we detected slight swelling of the spheroids after the sonication and a reduction of the spheroid area over time. The gamma H2AX assay was performed 1 and 24 hours post-treatment to explore the potential of FUS to affect DNA repair. Flow cytometer analysis of dissociated PC3 spheroids revealed a significant increase of fluorescence intensity, indicating that FUS leads to DNA damage and thus to cell death. I would like thank you and please check our in vivo abstract.